Hi everyone, I'm Dr. Gaurav Patil. I'm here to share my personal experience during this pandemic so far. To start with a timeline, I first heard about the coronavirus somewhere in January from newspapers, news, random discussions with friends and colleagues. I traveled to Malta after that in the first week of February where I saw some tourists wearing masks. When I came back, I read the hospital's emails about policies, plans, and standard operating procedures regarding managing patients with this virus. I was still quite naive about the situation when I was getting my mask fitting done and getting my donning and doffing training with the personal protective equipment, that is, wearing and removing it in a specific way. Reality hit me when I entered the hospital on a night shift somewhere in mid March and saw the coronavirus warning notices on the doors of one of our intensive care unit wings where I was supposed to work. I realized that this was time to actually don the PPE, treat patients, and then doff. I had to do this multiple times, and I needed to do this for the forthcoming few weeks, if not months. The fear of contracting the infection was and is always there, but I think I just got on with it like the rest of my colleagues because that is what we doctors and nurses are taught, that the patient always comes first. Performing procedures in PPE is an altogether different ball game. It is extremely difficult and challenging. Also, most of these patients had to be turned onto their tummies for improving their ventilation and then back onto their backs. And this had to be done repeatedly, and it was labor intensive, which only meant our shifts got busier. A unique mental challenge that I faced was and is communicating with patients, relatives, and family and updating them about their condition. This was usually done over the phone as their family was usually in self isolation. It is difficult to communicate with them, especially if the patient's condition is deteriorating. Most of them used to break down on the phone, and it was very difficult to handle. Most of the times, I used to give the patients an opportunity to communicate with the family before we took them to intensive care, but sometimes it wasn't possible as they were deteriorating really quickly. All these factors took a significant mental toll on the entire healthcare team and me as well. Luckily, the trust has a helpline to cater to staff's mental health issues, which is very helpful. I also transferred three patients to other hospitals on a ventilator because our hospital was full and we needed the beds for other patients, and also our dialysis machines were occupied. This transferring in PPE was also extremely challenging and has different posed different challenges. There has been a significant change in my work life balance as well. Every time I leave the house, it is like I'm going to war. I have a feeling of impending doom, and I see fear and worry in my wife's eyes. Even at home, a considerable amount of time is spent reading and watching news about the pandemic, especially since my family is in India. I am communicating with them frequently to allay their anxiety about the rapidly developing situation in the UK. My wife is at home as her part time job has stopped due to the lockdown. I've had to totally isolate myself in a separate room as I'm a potential risk to her. We also have to find new ways of entertaining ourselves while maintaining social distancing. In spite of all the precautions at home and work, I started experiencing dry cough and body ache about 3 weeks back, and that's when I decided to call in sick. I was asked to self isolate for 7 days. My wife, being a contact, she was asked to self isolate for 14 days, but her symptoms started 2 days after my symptoms started. I was lucky enough to get tested, and 24 hours later, I came to know that I had tested positive. On one hand, we were both being strong and casually treating it like a flu, but deep down, I was scared because of all the death around me, and also I was feeling guilty for giving it to my wife. Her symptoms got worse after mine, and she also had a degree of breathlessness, but luckily she did not need any hospitalization. We supported each other well during this time, taking medications regularly, regular gargles, steam, etc. A friend was really helpful and dropped off some groceries as we couldn't go out during isolation. We decided not to tell our families as they would get stressed but also feel helpless. After the fifth day of my symptoms, my fever broke and I started feeling better. My wife experienced the same thing, but she had lost her sense of taste and smell. We have both recovered, and I have recently told our families about our symptoms. They are still worried, but they are glad to hear and relieved to hear that we are okay. There is a bright side to this, that we are connecting more with family and friends more often than we usually would. Also, there has been a lot of appreciation from the general public and corporate brands in terms for healthcare workers, in the form of applauses, videos, discounts, free food deliveries to hospitals and homes, and also some free goodies. All this appreciation has encouraged me to march further in this fight against this deadly virus, and I have resumed work. This pandemic has given me a once in a lifetime experience of a crisis situation and continues to test me, not only in terms of my professional knowledge, application, and efficiency as a doctor, but also my character, strength, resilience, and courage as a human being. This situation is going to change us all for the better, and I'm fairly confident that we will emerge out of this victorious. Take care and stay safe.